Hello, everyone, and Happy New Year. Thank you for joining us today. Welcome to Clean and Healthier Nature Initiative. As my partner has rightly said, we have been doing this consecutively now for, I think this should be like our 30th
31st.
or what's the number?
31st.
31st webinar. Yeah, 31st webinar. And we're giving ourselves the flowers because, it's not easy to do things consistently like this, especially especially because it's not an area that people are quick to jump on. It's not like it's not a trend. It's not a I would say an interesting trend for people that are not in this space. But regardless, we have been able to continue our, I'll say, quote, our Lord's work. And we're here today, another year, and we're definitely going to continue till the end of the year. And hopefully this can be bigger than it is. So welcome everyone that has joined us. And we have an amazing guest speaker. We're always happy to have people like you join us because it's such a privilege, right? In this space, we're not a lot in this space, right? So the more the merrier, right? And it's always good to share knowledge, especially if it's around topics that can, save lives and give people, sensitize them. And this topic particularly is very interesting and would be dear to my heart because very recently I had a house fire and we had a lot of pollution, and it wasn't something that we expected. Aside that, even during the process of trying to renovate, there was also more pollution. As you can imagine, we had to paint, we had to use a lot of chemicals, we had to fumigate because the house was literally just open and everyone was going in and coming out. We had black soot everywhere, right? And I can't say that it was something that I expected, and I cannot say that I had any sort of like sensitization around that topic, although this is an area of, I'll say, specialization for I and I media as well, but not to the extent of having like a first-hand experience. You get what I mean? You could move into a house and have to do like little repairs, but it just seemed like we had to do like a overhaul of the house entirely. So I'm very pumped about this topic, and I can't hear what you have for us today. And I'm sure that everyone who has joined us today is equally very interested. So without wasting more time, I'd like to introduce our very beautiful guest speaker from America, right? Thank you so much for joining us. I would just want to be sure that everyone can hear me very clearly before I introduce her formally. Yes.
Yes.
So
Yes.
our sister from Benin Republic, a place I was supposed to travel to next week. Hopefully I still go, and I'm very excited to visit. She's a senior at the Indiana University Bloomington School of Nursing, where her journey is marked by a deep commitment to helping people in times of need and promoting health in undeserved communities. She was born and raised in Benin, West Africa. Theophilia's cultural background enriches her perspective on healthcare disparities and motivates her to make positive impacts in undeserved communities. Her dedication to academic excellence is reflected in her status as a recipient of the Hudson and Holland Scholar Award, the IU Bloomington Excellence in Leadership and Nursing Diversity Initiative Scholarship. And in 2022 summer, she explored different health care issues from intercultural perspective of the British and the Dutch in London and Amsterdam. And while she was abroad, she was awarded the Benjamin A. Gilman International Scholarship Program of the U.S. Department of State's Bureau of Educational and Cultural Affairs. And, for the future, she envisions herself as a professor and trainer of nurses, aiming to shape the next generation of healthcare professionals. And while she's free, she loves to cook because it allows her to try new recipes and cooking techniques from different parts of the world without the pressure of deadlines. Welcome, Theophilia. I hope that I pronounced your surname Denadi properly.
Thank you so much. Yes, you did, Theophilia Denadi. Thank you. And we would love to have you in Benin for pretty soon. If you go there, tell the people I say hi.
I will. You're welcome.
Thank you. Well, it's a pleasure. It's a pleasure to have me here. I was invited by my good friend Ayomide, and thank you so much for your invite. Thank you. So I think, okay, are we okay to start? Okay. Okay, I'm going to start by sharing my screen. I have a PowerPoint presentation about the impact of household air pollution on health. And I also, at the end of my presentation, I also have a small study case that we can do to kind of like go in depth a little bit, see the impact like it can have on health and stuff like that. So let me start with sharing my screen. Okay. If you can see, just let me know. Okay, perfect. And let me start the presentation. Okay, just let me know if you can see the presentation.
Yeah, we can see.
Okay, perfect. So the topic of today is the household air pollution impact on health. So you may ask yourself, okay, so I have a question before I start. How much time do you think as an individual we spend indoors? And you can write your answer in the chat box or unmute and just say the answer.
90%.
Sorry?
90.
No,
90?
no, I disagree.
Yeah.
Wait, you said 90% or 80%?
90.
90. Okay. Let me see. I have in the chat. 88. Okay. 76. More like 70. Yeah, 70. Interesting. Okay, so we actually we actually do spend 90% of our time indoors. So that means we are just outside for 10% of our time, going to work or maybe to the market. But the rest of the time, we are in the comfort of our house, just living and breathing in our room. Yes, I was also shocked when I literally read that fact. So yeah. Then let's get into it. So what is household air pollution? Household air pollution can be defined as the use of inefficient and polluting fuel and technology in and around the home that contain a different range of like health damaging pollutants. This affects over like the whole earth, and over 3 million people do die prematurely each year from disease caused by household air pollution that we will get into in a little while. And most of the people affected by this are women and children, because they are the most, they usually stay at home the most, and especially in the sub-Saharan region, usually mothers and children stay at home, do household chores and stuff like that. Okay, so the cause of household air pollution, I call them the threats, because they are basically the reason why all these things, all this health, sickness or diseases happen. So the first one that I have here is the combustion sources. So we have wood, we have some fuel, some diesel, anything that we use to cook at home. We have also our stoves. Like, yes, we do have the woods, but then what, like, kind of like the wood stove, the three wood stove, the clay stove and stuff like that we cook with in our houses. Usually, I mean, our houses, I'm referring to the sub-Saharan region. We also have some tobacco smokes, like cigarettes, pipe, hookah. And finally, we have some cleaning supplies. We also have some paint and also some insecticide. And all those things, all those threads literally contribute to particles, contributes to gases in the air that then go ahead and affect our health. So what are some of these particles? We call them like air pollutants. We have the particle matter, then we have the carbon monoxide. We have some like the nitrogen dioxide, and then the sulfur dioxide, and the ground level ozone. Most of those things come from burning wood, using diesel, using fuel, or just the part, like the outside air pollution coming in our house through ventilation, opening of doors and stuff like that. Okay, so like we said earlier, we spend 90% of our time indoors. And the long-term exposure of all those pollutants that we just saw in the previous slide cause about 4% of the global death. And out of those 4%, 30% of like the death from the sub-Saharan African region, like West Africa, South Africa, and region like that you usually use low cooking technologies, maybe burning woods, or maybe like houses going to flame and stuff like that. So what are some of the impacts on health? I know I've mentioned like what pollute the air and everything, but one of the major thing like system that it impacts is the respiratory system, because the air that is around us is the one that we breathe in. One of the major impacts is lung cancer. The other one is COPD, and COPD is just that your okay you are not getting enough air into your lungs. So I kind of like use this cute picture to show basically the meaning of it. Then we have pneumonia. Pneumonia is the inflammation of the air sacs, your alveoli, where your air get exchanged in your body. Then we have asthma. Your lungs is not getting enough air due to some constriction, bronchoconstrictions. Besides some respiratory health impacts, we also have other health impact like some heart disease. Basically, the ischemic heart disease is when your heart is not receiving enough blood itself. So the coronary artery, which is the artery that brings blood to your heart, is not receiving enough oxygen for the heart to function. We also have type 2 diabetes. This can also lead to type 2 diabetes, and type 2 diabetes is basically high blood sugar in your system, and this can be due to inflammation of those like caused by all those particles that I mentioned earlier. The next thing this can cause is also stroke, and stroke is basically when there is not enough blood going to your brain. And then one of the major cause that we see out in the world is adverse birth outcomes. So that can be anything from low birth weight to birth defects. So pregnant women exposed to all those particles, exposed to all those fumes, to indoors pollution can lead to the baby not developing well, the baby having being underweight and having some diseases when they are born, which will lead them to the neonatal intensive care unit, the NICU. And just to check in, do we have any questions so far? Okay, perfect. So let's go into some solution. Like I mentioned, there is a lot of pollutant in like there's a lot of particles in the air that has been affected, that affect the organism, that affect the heart, that affect the lung, the brain, and even the children. So what can we do about that? One thing that is very major is source control. Source control means basically regulating what you use, like regulating what kind of technology you use to cook, also regulating what you use, like your cleaning utensils, your cleaning products and stuff like that. Also regulating smoke around your house. If you do smoke, do you smoke indoor? Do you smoke outdoors? And all those things, you controlling it can just make your environment feel lighter. The air more cleaner. Another thing is improving ventilation. I know like in some houses, access to window, access to clean air is not possible. So actually opening the doors during the day, letting the air come in, having the windows open, make circulation very easy and the air to come in and out of the houses. And also the third thing is creating awareness and basically talking about it, talking about the cause, talking about the impact of household air pollution and health, talking about how, asking other people questions about, okay, what do you use? So what do you use to cook? What kind of technology do you use to cook? And all that, by creating awareness, we will educate people about household air pollution. We will encourage behavior changes, and that will lead to people switching from maybe using low-level technology cooking to using more a more higher level that will reduce emission into their indoor spaces. Also, this will promote cleaner technology and then get people to advocate for policy changes surrounding the area of household air pollution. And the next thing I have is a study case about air pollution. Before we go into the study case, do we have any question or any comments?
Please, if you have any questions, you can put it in the chat box so that our speaker can address it, or any comments, contributions, or you can unmute as well. Any questions, comments?
Okay, perfect. So let's go into the study case. So here in our study case, we have Adele. She came to the hospital for the birth of her baby girl. at 40 weeks. At birth, the doctor noticed that the baby weighed less than the normal baby, which is like between 8 to 10 pounds. I would say 8, like 7, 8, 10 pounds. So the baby weighed less than the normal, the average. She was immediately transferred into the neonatal intensive care unit, the NICU. And in her postpartum room, so after birth, while she was resting, the nurse came and asked Adele about her living situation and her employment, just to figure out, okay, what can be the cause of the baby being like having a low weight at birth. So Adele mentioned working as a teacher that is living in a one-bedroom apartment with her husband. So while discussing some pregnancy habit, Adele mentioned getting into cleaning at the beginning of her second trimester. And she bought a lot of new cleaning supplies, new cleaning products, and she referred herself as a clean freak. So the question I would like us to think about is what are some potential factors from ideal living condition, employment, and pregnancy habits that might contribute that might contribute to the low birth in her baby, and what are some subsequent needs for the NICU admission? Oh, sorry.
You want us to answer the questions?
Yes, please.
Okay.
What do you think are some factor that affected the baby low birth weight?
Yeah. I think we can unmute and have a discussion, and since it's a case study.
Yes, absolutely, please.
So if you have any idea of what might have caused the baby's weight to be low, let's talk about it. I think that maybe the cleaning products, sometimes when we inhale, someone already put it in the chat box, inhaling toxic products like
Yes,
bleach.
definitely.
I don't know what the actual constituent of the product it might be,
Wait,
but
let me put it back. Yeah, okay. Yes, definitely inhaling products, because why do you think inhaling products matters as much? Because okay, like from the case study, why do you think it matter more, like it matter when she start using the inhaling products?
to say that again, like rephrase
Like
it.
okay, okay, the question is kind of like, why do you think the period matters when she started using the cleaning products?
Well,
Why do you
because
think that matter?
well, I think it's because at that point in time the baby was still kind of like forming, so that there will be like some reactions that might happen. Of course, we know that for chemicals to be toxic, there are different route of entries into our body. So somehow, I mean, I don't know how through the nose might have affected the baby's overall development, because it was at a vital stage, and we know that at a certain stage in pregnancy you're advised not to do certain things because the baby's growth and formation is fragile at the time. I believe that's my
Yeah, I can see some of Dr. Onifade's comments here. Please feel free to unmute. This is your field.
unmute. Yes, exactly.
Yeah. So she's talking about earning a low income,
Income.
so her
Her
feeding
feeding
might not be
might not be
optimal.
optimal.
Mhm.
She could have also reacted to cleaning agent she bought.
Yeah. Then Osas also
Then
has some points. Yeah, about eating a proper diet.
Yes. I mean, you can unmute and contribute. It's like a discussion. If you, I mean, this is also okay, by the way. But if you have any other thing to say, you can unmute and let's talk. I think we're all same
Since
page.
hello,
Can hear you
can everyone
loud
hear
and
me?
clear. Yes.
Okay, since we're talking about fertility, I did a research recently and I found out that indoor air pollution also leads to sperm reduction. It affects the quality of sperm in men. So a study was conducted on healthy men of reproductive age, and it was found out that those that were exposed to this pollutant, most especially the PM 2.5, stand the risk of infertility over time. So it changes the motility, the morphology, and the DN fragmentation index of the sperm. So it's something that we really need to look into, especially we are from the sub-Sahara region. We are usually exposed to this and we don't really know the cause. That part of the world, any infertility issue goes to the women. But research have shown that air pollutants, indoor air pollutants, also contribute to this.
Male. Wow. That's a great
Yeah.
contribution. Thank you.
Then I'm thinking of a possible general and affordable solution to this indoor air pollution, because I feel it might be inevitable because people have to cope. There are some activities that you cannot do without. So do you think having an hair filter at home might help in some ways? Yeah, I know hair filter for some people might be a bit pricey. So, but just thinking of some, well, practical solutions, or maybe for some people that are technologically inclined, maybe we can have an innovation that could help to mitigate or reduce this impact of air pollution. So just thinking out loud about possible
Yeah.
solutions to mitigate.
I think that
I
might
said
be
like
hard. Just my own 2 cents, because it's not just about some of the products that we come in direct contact with. For instance, in the case of this lady, there is no way that she would not. I don't know if that's the case. If any of the cleaning agents had anything to do with the child's birth rate, I don't see how she would not inhale it at some point. And of course, she's a clean freak, so she probably does it like frequently, maybe like every day. She cleans every day. She'll use bleach every day, detergent and things like that.
Yeah.
definitely. And I feel like at least in her case, one other factor is that she also live in a 1 bedroom apartment. So we don't know how much ventilation or like air circulation she gets in that. So while using all those cleaning products, the air inside she can be trapped in the air, literally breathing in and out the product all the time, which could affect, like Osad said, affect the baby, because the second trimester is when the baby start developing, when the organs start developing, and so on and so forth. And some about her employment, like she said, maybe she might be earning low. Maybe she might be stressed about her job, like her employment, taking care of multiple kids at school and then coming home taking care of herself. That also be a factor that could affect the health of the baby, the baby being born. Yes.
So some of us are clean freaks. I know some people here that are clean freaks. So how do we go about, using clean supplies? I know somebody here that the person will not mind, cleaning for hours. So now that we have a case study that is talking about, cleaning, and I'm glad that we are talking about cleaning here. So what do we do? I know we can't stop cleaning. So is there a way to watch out for the type of cleaning supplies or products that we buy, or, use organic? And in some people have told me that using some organic cleaning supplies, they are not very effective. So they prefer the harsh ones that we remove the stains. We remove the stains on the toilet seat or the bathroom, So what are your recommendations on cleaning supplies?
I feel like mainly reading, like when you're going to buy stuff at the stores or to the market, reading the labels and making sure that the particles, like the ingredient, are not harmful. And I don't know. I didn't do much research about like some chemical that might be harmful that you can find in cleaning supplies, but I know most of the cleaning supplies like bleach, when you are working with them, make sure you put them to sit for a little while before you, let's say like you're bleaching, you want to wash your bathroom and stuff like that, you put bleach in your bathroom, just let it sit for a little while before you continue your cleaning and stuff like that. But for in terms of specific chemicals, I really don't have like any concrete answer. Yes. And
Oh,
also
thank you.
opting for alternative. I know, like you mentioned, organic stuff are very like not spot on, and you feel like you have to clean and clean over again. But
Sparkling. Yeah.
I believe that could be another alternative.
Yeah.
Okay.
Yes.
We have V right she has her hand raised. You can unmute and contribute.
Oh, yeah. So I was just going to say something really quickly. So in England, right? So what we tend to do is, if you're pregnant, you have like certain checkpoints that you need to meet with your OBGYN, and they monitor like your baby, your habits, and everything. So they kind of try to. I think it's almost like a preventive measure where you don't get to the stage Adele got to. But my question would be, so to speak, as for the fact that Adele got to that point, why was it, like I think it's still the OBGYN, I should say. Why wasn't that monitored from day one in terms of her habits, being a teacher, and going, okay, if you are low risk or you have potential health issues, you need to go easy, you need to have certain rest periods or be on bed rest and things like that. Like, aren't there systematic like factors in play that would have already prevented that from happening? I'm not sure if that makes sense. I'm just trying to kind of like think about it all the way through, if that makes sense.
Yeah, that totally makes sense. Actually, if your baby is kind of like low birth, you can tell that by 27 weeks, 28 weeks when you go to the doctor to go to the OBGYN. Oh, I know. And but the thing sometimes is during those development stages, some baby, like some organs might be affected, and then the doctor, the OBGYN will be able to tell you. But some baby being low birth, um like for some babies, you can really not tell like if they are high risk of other diseases until they are born and stuff like that. So I would say this can surely be prevented. And also asking the question that I've been asked during her observation, during her consultation at the OBGYN, do they ask about her environment, do they ask about her habits and stuff like that. So all those questions are kind of like factors that can determine the health of the baby, but what they address during those visits is something that like the OBGYN or maybe the nurse practitioner will have to address. And how often is environmental question addressed during OBGYN visit, during nurse practitioner visits?
No, I get that. Because I feel so like, like obviously you've got health issues that run in families. So you look for those and kind of go, those can be like premeditating factors in terms of like when you have a child and what that could, result in, and if that's a high pregnancy risk or low pregnancy risk. So you take that on board, and then you kind of have to have that sit down and go, okay, so if you're bringing a child into the world, like this is what it could possibly look like, and this is what could come from it. And obviously having that conversation might not be as easy, but it does make sure that the mum is set up in the right way. We have a system where you don't just talk to your OBGYN, we have therapy services, we have I forgot what the name is. Sorry, I've only worked briefly in an attachment for how I work in HR, so I just kind of know we have like outlets that we can always post people to. But I know we have I forgot the service. So essentially, they're like help workers and they come and check your place. So if you stay in like what we call council houses, which is like government buttes, they check it, they make sure that this is it, because it's almost like, well, you guys over here tend to like sue for stuff. That's not our go-to. So we just kind of go, how can we prevent things and like get it to a point where both the mum and the kids are in a good place. So obviously, if she's in a 1 bedroom with a husband as a teacher, she's working and stuff. And yes, I'm the one that somebody was referring to as the cleaning freak. But you kind of go, okay, what are those things? Because I don't think any mother would kind of go, oh, you know what, I'm going to do stuff to work myself up and put my kid at risk. No, they wouldn't. And I think like if she had those measures where it's like, okay, those are the things that would help, or those are the things to prevent, those are lines that might help. I think like, what's her name? Is it the Jessica Alba or someone like that, who has like a really like baby form brand, and you get signposted to things like that. I think it does serve to kind of put mothers or expectant mothers in a better position of having the right information and knowledge at hand, but also being better informed and prepared of what that journey might look like, and not just the journey itself, but what comes after the baby is arrived. Especially like when there's babies and the NICU is like, okay, so don't worry, this is what is, and kind of like setting them, and because you don't want a mom that's just put to bed going, oh, it's her fault that this child is like this, oh, she shouldn't have done that, she shouldn't have done that, and carrying that guilt around, especially like postpartum stuff. But yeah, that's my little 2 cents.
Yeah, that's totally understandable. And that is kind of like a reason why we need to raise awareness to this, because household air pollution, most people do talk about in outdoors and stuff like that, but most people don't know the impact of household air pollution. They might think they might be safe in their house, is not going outside, not being exposed to all those cars and fumes and all those things. But the real danger now, and we're finding out, might be in the houses. So raising awareness to, let's say, for example, if Adele was aware that there was something such as household air pollution, let's say she was not, that could maybe impact what kind of product she might be using, or
Or the
maybe,
frequency.
sorry?
Or the frequency.
Oh, the frequency, exactly. So, like we said, there is so much we can do if someone is not aware of the solution, of the danger.
Yeah.
I think it needs to start at grassroots levels, whether it's flyers in the OBGYN offices, or a local campaign at the pharmacies, or getting your what's it called? Your government? Well, not government. Sorry, I'm trying to think what the equivalent is for the state. So like getting the state involved, where it's like a campaign that is being run and then centered around that. I think like those little efforts make a difference. Even like, like the little mummy groups where you take your kids to, and all of that. Like those little bits, it might be passing knowledge, but guess what? You will soak it in subconsciously and it will stick with you. So when you do get to that point, you then go, oh, I remember reading something like this, or I remember seeing something like that. And it does help. So I think it's like every little effort that can be made would make that much difference, where it's like, oh, it does put them in a better position not to be in, to be at loss for the information that they might need at hand. But
yeah, that's why we're here having this conversation. That's part of what we're doing. You never know how, conversations like this, how far it can go, and that's why we continue to do this on a monthly basis, so that people can have people can be rightly sensitized about this issue. And now people that haven't heard it before, they've heard it here. and you go ahead to tell other people about it. However, I do agree that, it needs to be done more aggressively than it is now, because a lot of people have no idea about these issues. And I also think that to just add I think that the case study, because of the topic at hand, it kind of just shows it one perspective, and that's what we're discussing here at the moment, not the other perspective of the OBGYN. I know that babies, you could tell their birth weight and at a certain point in time in the pregnancy, and you could tell if they're at risk of any sort of condition. However, that isn't mentioned here because of the discussion at hand, and the point of view, which is pollution, right? So I think that you can go ahead and continue so that we can.
Yes, thank you. Thank you so much. Thank you, V, for the questions and the contribution. Really appreciate it. So, so some of the other stuff that, like we say, we talked about her living situation, her house being maybe not really ventilated, and that could cause that could be a factor for her being exposed to a higher concentration. We also talk about her employment that might be a stress on her. That can be a stress on her pregnancy. We also talk about the cleaning habits that she has. Like, she was frequently cleaning the stuff during her second trimester, and that, like we said, that could raise the impact on health, like impact on the baby's health. So this is what let's see if I can restart this. Okay, let's just restart it, I guess. I don't know how to do it. Okay, so those are kind of what like can be seen from that. And I also had a study case, but I just didn't put it because I thought this would be very long. But I can just say it, and
Yeah.
we could literally discuss about it. So my second study case was going to be on, let's say, this lady that sells on the street. She is a street vendor, and there is something I love. I love Akara, so let me just use that as an example. She is an Akara street vendor. She has been doing that for the past 5 years. So she will go every day, set up her stuff, bring her appliances from the house, set up at the street corner or in front of her house, and sell Akara for like from a certain time. So she comes to the hospital with some shortness of breath. She comes to the hospital not feeling fine, coughing, and while she coughs, she have like mucus and stuff like that. What do you think might be the cause of her coughing and her feeling like very tired, or maybe her not feeling good?
Floor is open for discussions.
Yeah, definitely, she's a street all car seller, so definitely maybe pollutants from vehicles, emissions from tailpipe emissions from vehicles and generators. So for her to be okay, definitely maybe it's Africa. So maybe from generators in houses, in commercial centers. Yeah.
Definitely, being exposed to, first of all, the public, the outdoors air pollution definitely can cause her health to go bad, and her having shortness of breath can all be exactly fumes from car. Thank you. Can cause her to literally her respiratory system to fail, and that might then generate a lot of diseases such as COPD, which is chronic obstructive pulmonary disease, dust particles, exactly. And also all that can lead to her being very tired, her not being able to continue like her work, her employment, her becoming unemployed due to all those exposure. So this, I'm just saying, kind of like this study case was to show that this not only affect our health, but also affect the outcome of like our employment. And from all those exposure from dust particles, particle matters, and just all those air pollutants can affect our health, and then in the long term run may make us dependent on other people, dependent on other people's income and stuff like that. This is not just our health, but also our career, our work, our employment. Okay, perfect. So let's move on. So let's go to a conclusion. So this is all that I have. And from this presentation, from this, we will define the the household air pollution as like is the use of like inefficient pollutant fuel and technology in or around the home that can contain different range of particles that damages our health. Like we said earlier, this affects over 3 million people over the world. And this is not just a problem in Africa, it's also a problem in Asian country like China and India, which actually do have the higher percentage of death rates, over 60%. Double the one in Africa. And some health risks that are related to the household air pollution can be COPD, can be pneumonia, can be asthma, can be lung cancer, and other health disorder can be heart diseases, type 2 diabetes, stroke, and like we saw earlier in our case study, the adverse of birth defect in newborn babies. What we can do to for this to be like better for us to what like some solution for this can be creating awareness, like we talked about earlier, controlling the sources of our pollution, using better stove, ventilating, increasing ventilation indoors to make sure that our outdoor air is being exchanged frequently, so that we will be able to, we will not be exposed to as much particle as we used to. Okay, and this is all I have. Do you have any questions?
Any questions, please, you can unmute or just signify, and we can take our speaker can take your questions very briefly before we call it a day.
Yeah, for me, this is not like a question, but like this presentation has made me to see another very possible topic of talking about indoor pollution and maybe pregnant women or infancy, or birth of babies and things like that. So if you can do like a research on that, or maybe we as a team, we can probably also look into that and see like how we can create some awareness on indoor pollution as it affects like pregnant women, birth rates, infancy, and all of that. So yeah, that was quite insightful. I enjoyed that part of the discussion. Thank you.
Yes, I agree with you, Ayomide, because sometimes even the most educated person might not have all the information in the world, as regards to health consciousness and topics like this. for instance, people would usually just assume that it's only by the food that they ingest that their babies can be affected, or, you know, some other factors that, you know, cannot be controlled. But I mean, listening to our speaker today, you can tell that you can also inhale substances that can affect the overall health condition of an infant, right? I also saw somewhere that even, you know, things like what's it called, fragrances in the house and diffusers have like a very highly adverse effect on our health. I don't know if any other person has seen that, you know, these diffusers, electronic ones, and, you know, artificial essential oils, they have like a very adverse effect on our health. So I can imagine if that would affect, you know, a person's health, how that would affect a pregnant person, a pregnant person, and, you know, the baby that she's carrying, how adversely that can also affect. So yes, we need to do this more, create awareness. I think maybe even go to clinics, give them, you know, charts where people can just, you know, look at as a glance, maybe in the hospital, can put it somewhere, you know, where pregnant people visit, you know, during their antenatal period. So yes, if you have any other questions, okay, somebody has said something in the comments. You can read it.
Oh, where? Oh, it says, yeah, is it the last one?
Yes.
Okay, yeah, those little things that might look as if they do not they do not matter actually matter the most. Yes, definitely. And like you said, that's actually the great thing that you brought up, like what we use in our houses, like just to make it smell good and stuff like that. It does matter, because we don't actually know the chemicals that are actually being put, what are the particles in the air that we've been exposed to. So that truly does matter.
Yeah, definitely. Thank you so much for your time. Okay, so she also said that excerpts from this session will be great to have so we can promote it. Definitely. We'll find a way to, you can, I don't know if you already follow us. Okay, my partner said that this video we put on YouTube, all our sessions that we have, and we also post like excerpts from our meetings like this on our social media. You could follow us if you're not already following us, A Clean and Healthier Nature Initiative, on across all social media. Ayomide, please can you put it in the chat box so that, you know, you can see and follow what we do. And also this is our gospel. This, you know, what we do here is our gospel. So we like to spread information that would impact our health and our environment in a positive way. Okay, you can go ahead and unmute. I can see V.
Hiya, so I was just going to say, like, with what you guys have said today, it's obviously clear that there is a strong need for the information to be dispersed in the most, you know, in the most, what's the word for it? In the most useful way, so to speak. Would you guys ever consider like having partnerships with like local clinics and health services and things like that? Like the OBGYN offices, pharmacies, things like that, where even if it does come out of pocket, it's printing out flyers and making like little videos that could be played in the waiting room, just so that that information is being dispersed and it's then being like spread out. Because I do feel as though like the little things, like I did say previously, like the little information and the little things that we don't tend to pick up while we're sitting around waiting for stuff, whether it's like a passing billboard that we see, or my mate said this, or just hearing it on, you know, on like a radio or whatever, we subconsciously consume that as well. Do you get what I mean? And then I think like in that way, it does kind of go, oh, I remember something like that, or oh, I could signpost you to this. Because even like when I go to the vets, right, for my dog, the vets have a higher wild range of, oh, okay, for this breed of dog, this might help. Of, if this feels this way, whatever. And it's like, to be honest, I don't have any kids personally, but I know the information and the support and whatever that's readily available to me when, I have an issue with my dog or whatever. And I'm thinking like, this is human beings, this is life we're talking about. Do you get what I mean? Like, my dog is my baby, but imagine like being a woman in that position and not feeling substantially supported enough. Do you get what I mean? You kind of, it almost is like, what you don't want to feel like you've already failed as soon as you've started. So you kind of want to be in a position where it's like, okay, where can I get those stuff? Because I think everybody on here, if I say this, as soon as we have something like, oh, this is wrong, we all up on Google, right? And Google might not always give the best advice, right? It might not serve as the best information portal. Taking that on board, given how the organization, right, is dedicated to that education and information, I do think like a partnership, whether a local level, even like with offices or something, just passing it out. Because I don't know, there's just something about this conversation that is just like in my head. All I see is that information needs to be dispersed. Do you get? It needs to be addressed because even like the lady mentioned about like the what's it called, the fuses and stuff, right? I used to have all of those, even into candles and stuff. And I know, like, I didn't stop for myself. I stopped. Right. No, it's fine, are you? But yeah, I think it might just be like a really strong way to go because I've always known like you guys are quite passionate about this. And obviously the health initiative and what that means. And it's not just for like pregnant women and stuff. I think like even for someone like me who's asthmatic, like going out and having like smokers thing in my face and stuff, it irritates me. So I know, I think like you guys have so much passion for it to just keep it to, oh, we'll do this once a month. Like you do your research, you do the work. I feel as though like you could have such a strong impact on the community, whether it's, immediate community or, across the board, going over like countries and whatever, and just because the information is still going to be relevant, whether it's in England or in US or in Africa or whatever, it's still going to follow the same path. Do you get what I mean? But yeah, that's just my little 2 cents, isn't it? Yeah, okay. Sorry. But yeah, I've always done like you have such a good access to your checks and your passion, and having that flow through already speaks volume. Right, like just listening in, and I came on because I just posted it, and I was like, oh, you know what? I'm curious. I'll see what it's about. But that comes through. So imagine if I was in that position of being pregnant, and I'm listening to this, and I'm hearing this. It might be like, oh, I do want more information. Oh, where can I get this? And how do I communicate with this? And how do I, interact and follow this up and everything? And I think like it might just be worth making that channel more accessible, whether it's out of pocket or partnership or whatever, because I do feel as though like you guys could really go really far with this. But yeah, I know what you guys have in the works, but yeah, that's my little sense.
Yeah, thank you. That
Thank
makes
you.
sense.
Thank you
We're
so much
definitely looking at that. Thank you.
for that great contribution. Thank you. We already even chatting about it privately because I like the way that you feel strong about it. We do as well. And then sometimes, like I said before, when you have conversations like this, you see like where you're lacking and what you could do better. And I'm glad that Denadi has spoken about this great topic. Obviously, more people need to be aware about the impact of this household products, how it can affect. I'm glad that she even brought up that case study, because without the case study, I might not have understood like the impact on the next generation. So you could think that it's just your health and you could gamble, but then if it impacts unborn children, it's a different ball game, and it's something that you really need to sensitize people about. And I like that you also mentioned about the pharmacy. Of course, we're always open to collaborating, and now that you mentioned it, we're definitely going to put our thinking caps on and no matter how small how small we can start, I'm sure that when we start, people would, support us, because it's just, it's just great to have that information out there. Thank you so much, Reed. Thank you, Viayomi. Did you have anything that you want to contribute before we call it a day and thank our very beautiful guest?
No. Like, it's been a very wonderful session. So yeah, thanks to everyone that joined, and thank you so much, Theophilia, Chief Nursing Matron Officer.
Thank you so much. And I do have some references at the end of the PowerPoint, just to back up the information. Thank you.
Thank you so much, Theophilia. And that's the thing, like when you get, opportunities like this to speak, sometimes you might be too tired or too busy to take up such opportunities, but you don't know the lives that you'll be touching, or it might seem small. We're about just between 20 and 19 people here, but then some of these things, they have like their impacts can be greater than you can imagine. And I mean, from this meeting, obviously we're going to go out there and preach the gospel of what we've just heard today. Fantastic. Thank you so much for joining us. We hope that you honor our invitation with another wonderful topic another time when we call you. Thank you to everyone that has joined us today. We're right on time, and we'll be calling this meeting to a close. We do this every month, by the way, and we usually always have very amazing topics, and we always have great people like Theophilia come and take their time, create slides just to impact knowledge in the best way that they can. So please join us next month. It's usually on the third Friday of every month that we do this, and we come up with very wonderful topics that we discuss and we gain knowledge from. So please try to make this a thing, and we'll be expecting that even if you're not going to be talking next week, you can join us and listen to someone else. Thank you so much, everyone.
Thank you. Thank you so much.
Great. You have a lot of I'm proud of you.
Yeah. Hi.
In the comments.
I have my dad on the call, so that's very exciting.
Oh, wow. Fantastic. Yeah. Thank you so much for joining us, sir. And the daughter is doing an amazing job, and we're very happy to have her here, and we're proud of her too.
Yeah, and a lot of my friends. Thank you guys for joining. I really appreciate the support.
Thank you, everyone. Thank you so much. So the meeting is officially come to an end, and we can go about. Please don't forget to tell somebody what you have heard today, and to tell another person. That's the most important thing, and that's why we've had this meeting today. Thank you for all your contributions, V, Chukudi, everyone who typed and said something. Thank you so much. And join us next month, please. Thank you.